Welcome, everybody, to the workshop on menopause. I know this is such a popular topic for so many of us who are somewhere on this continuum, either naturally or unnaturally. So I'm glad you can all be here today. I'm Amy, the programs coordinator from Breast Friends. Most of you know me, but if you're new, feel free to reach out to me with any questions about any of the programs that Breast Friends runs. Happy to try to answer them as best I can. We are here today with some graduating people from I'm going to try to, I always call you guys NUM, but I realized I'm probably saying it wrong all these years that I've been talking about it and we've been doing cooking workshops. So it's the National, is that right? University of Natural Medicine. All right, I got it. Um, and we have Rachel, Miles, and Tia with us, and I'm gonna let them just introduce themselves and tell you a little bit about themselves and what their areas of specialty are, and how do you guys want to handle questions? Do you want people to go like during the flow of the presentation or save questions till the end? Any preference?
I think personally, questions at the end might be easier for me, but if my
Okay.
colleagues feel differently, I'm certainly open to as we go.
Yeah, at the end would be great. And if you don't want to forget, if you want to like pop it into the chat, we can like
Mm,
go through the chat at the end if that's helpful.
yeah. Yeah, it's kind of hard to hang on to your questions sometimes. So we'll definitely look in the chat at the end. Okay, well, with no further ado, go ahead and you guys, I'll let you just take it away.
Yeah, hi. First of all, I just want to say thank you all so much for being here. We weren't sure what the turnout was going to be on this beautiful Sunday afternoon. So thank you all for joining us. My name's Miles. I'm a 5 of 5 year naturopathic medical student about to graduate. Um, Personally, I don't have any particular like serious interest besides like mental health and mind-body medicine. I consider myself a bit of a generalist, but I'm hoping, some of that will come through in as I start residency next year up in Washington. But I certainly love herbal medicine. I love lifestyle medicine. Yeah, so those are some of my passions.
Awesome. Thanks, Miles. My name is Rachel Schofield. I am a ND 4 out of 4 student, also graduating in, let's see, 3 weeks now, which is very exciting. My interests are women's health, gender affirmation care, fertility, menopause, and I just got accepted in the NUNM residency program. So I will be staying at my school to do a residency, which is really a primary care focus. So that is what I'll be doing.
Yeah, my name is Tia Hernandez, and I am also a 4 out of 4 year naturopathic medical student graduating. Very similar interest to Rachel, women's health, hormone health, fertility, and menopause as well. And yeah, really excited to chat with you all today.
Awesome. Thank you guys all so much. I think, Miles, if you want to go ahead and share your screen, we'll get rolling.
Great. Are you all able to see the presentation now?
Yes.
Okay, perfect. Well, I'll get started then. So we just introduced ourselves. Yeah, and I'm going to dive in a little bit more about what naturopathic medicine is. So we are all medical students in our final year at NUNM. It's a naturopathic medical school here in Portland. So we just shared our clinical interests, but among all of us, even though those interests may vary or be diverse, we sit with the recognition that despite any specialty we go into, that we're likely to see patients who are currently or have previously undergone cancer treatment. And we recognize the importance of knowing how that influences our approach and how to best support those patients. So a little bit about naturopathic medicine. It's a medical specialty, kind of with a foundation in primary care. that approaches health and tries to approach health in a holistic way. So we strive to give individualized care that minimizes harm as a forefront. Whenever possible, we like to prioritize lifestyle modifications and natural therapies, reserving more invasive interventions as secondary options. And this approach allows us to mitigate side effects and adverse outcomes, but it also gives us a whole new toolbox when conventional treatment options are not desired or in some cases not safe. And our goal for this presentation is to provide educational information and resources surrounding the topic of menopausal support or hormonal support in those who currently have or have previously had breast cancer and what those options might look like. Before we dive into this really fascinating topic that we're so excited to share with you all today, we're just going to take like 45 seconds for a little mindful moment that I'm going to lead us through just to help us arrive a little bit. I know as presenters, we want to present this information clearly to you, and we hope that it can be received in a good way. So we're just going to take a minute wherever you are. I just want you can close your eyes, keep your eyes open, and in a very gentle, easy way, I just want you to tune into where you are right now and how your body's feeling. Maybe just giving yourself permission to just be present for a second and just see what's here right now. Maybe noticing how you're feeling in your mental world, just taking witness, seeing what's moving in your emotional life and your energetic experience, and tuning into your body that's carrying this experience. Just noticing what sensations or what it feels like. Maybe noticing where you're sitting or standing or laying, how it feels to be supported where you are. Taking a minute to tune into the breath, that beautiful rhythm that's constantly bringing life and releasing what doesn't serve in our bodies. That's always working for us, but we're not always present to that. So just taking a minute to feel your breathing in and out. Noticing how life is giving you nutrients that your body needs and it helping you release what's no longer serving. And if there's something that's distracting you right now or calling you away from this moment, you can just acknowledge that and maybe let it release a little with an out breath. Putting that aside while we're here together to explore this topic, allowing yourself to just be present to receive. And at any point in the presentation, if you get distracted, you can always come back to that breath or the sensation of your feet on the ground or the chair. And with that, we can gently open our eyes again, maybe noticing how that feels different. And we're going to dive into this topic that we've prepared for you all. So I'm going to pass this over to Rachel, who'll get started with the next slide.
Amazing. Thank you so much, Miles. That was lovely. So again, I'm Rachel, and I'm going to just start us off by talking about menopause in general and some symptoms before we get into some treatments. So menopause is defined as the point in time that occurs 12 months after a person stops menstruating or stops having their period. Typically, this begins in mid-40s to 50s as a natural part of aging. However, it can start earlier for individuals who have undergone treatment for breast cancer. So there are several ways that breast cancer treatments can induce early menopause, like chemo-induced menopause. Chemotherapy can damage the ovaries, leading to an early onset of menopause. And ovaries are responsible for creating hormones such as estrogen. And these hormones are what run the menstrual cycle month after month. So when there's damage to them, that's when menopause happens. So there's also the surgical removal of ovaries, known as an oophorectomy. This results in an immediate onset of menopause, or something called a bilateral oophorectomy is when both of the ovaries are removed. And then there is ovarian shutdown-induced menopause. So certain treatments can temporarily or permanently shut down the ovaries and their functions. And then there's hormonal therapy-induced menopause. So hormonal therapies such as tamoxifen or aromatase inhibitors, these can trigger menopausal symptoms instead of actual menopause, just by altering the levels of hormones in the body. And then next slide, please. Thank you. So some of you may or may not be familiar with the symptoms of menopause. So there are things like hot flashes, which is the sudden feeling of warmth, this often intense feeling that usually affects the face, neck, chest, or the whole body. There is insomnia or difficulty falling asleep or staying asleep. This leads to tiredness, fatigue, brain fog, and just lower cognitive function, making day-to-day tasks a lot harder. And then there is vaginal dryness. So reduced lubrication can cause discomfort and pain during either intercourse or insertive self-pleasure practices. And then there's urinary changes, so increased frequency, urgency of urination, and sometimes even urinary incontinence. And then there's mood changes, so fluctuations in mood, including irritability, sudden mood swings, and then anxiety and depression are very, very common and often underdiagnosed conditions in postmenopausal individuals. So if you're dealing with any type of mood changes, anxiousness, depression, we definitely encourage you to talk to your healthcare professional because there's so many ways, either natural or pharmaceutical, that we can help mitigate those mood changes and help during this time. My cat decided to join me for this presentation. And then we also have night sweats, that intense sweating during the night that can definitely disrupt sleep, having people needing to change sheets in the middle of the night or change clothes. It can be very, very uncomfortable. And then low libido or reduced sexual activity. And then, yeah, understanding these symptoms is crucial for managing and just finding relief during this transitional phase. And then next slide, please. Thank you. So for the rest of our presentation, we will be focusing on natural remedies and lifestyle modifications that have been shown to provide relief from menopausal symptoms. However, it is important to remember that while we are very well-informed medical students, we are not yet licensed doctors. That'll take a few months. So it is for your safety and well-being, please ensure that you discuss any new treatments or changes to your health regimen with your healthcare provider before you begin. This is essential to make sure that the information we provide aligns with you and your personal medical needs and circumstances. And then just a special plug for naturopathic medicine. What makes our medicine so beautiful is that it is really individualized care. Just like with breast cancer, there is no one treatment that fits all. So with menopausal symptom support, it is really important that you have a doctor on your side who looks at exactly the symptoms you're having, what medications you're on, and your overall health history, and then also your goals and your desires for support to give you the best treatment possible. And with that, I'm going to pass it off to Tia, who's going to jump into the treatments.
Yeah, thank you, Rachel. Before we dive into our natural treatments, I just want to do a brief introduction to what conventional menopausal support looks like. So conventional menopausal support and first thoughts often include the consideration of hormone replacement therapy. So using outside hormones to replace the lower levels of estrogen we have from our ovaries no longer producing them. And for those with a history of breast cancer, there's an increased risk that's been cited in data for using outside hormone therapy. And the North American Menopause Society is an overarching organization that comes out with statements every few years, looking at the newest research available. And they generally only recommend topical hormone therapy for those who have failed non-hormone therapy, for those that have a history of breast or endometrial cancer. So for some individuals, their hormone therapy can be warranted for treatment, but when it isn't an option for someone, including a situation where it involves an increased risk of cancer recurrence, that's when we'll turn to these more naturopathic treatment options for symptom management. Go to the next slide. Okay. And before we get into specific things, I just wanted to give a little bit of background of when we're talking about using naturopathic medicine and how we're deciding therapies. We use something that's called the naturopathic therapeutic order. And we use this as a set of guiding principles within our medicine that outline steps that can be taken in the treatment of illness or symptom management that emphasizes the least invasive and most natural therapies first. It really helps us provide a structured approach to healthcare and focus on addressing underlying causes of illness rather than just simply managing symptoms and maybe not uncovering what's going on underneath. So if we look, we always start at the bottom of the pyramid. And the bottom of the pyramid is where we're setting foundations for health and removing obstacles to health. So what that looks like is we're just supporting the body in its ability to keep us healthy and become healthy. So a lot of focus on our overall nutrition, our exercise habits, our stress management habits, and then removing anything that's in the way of that. So if we're exposed to any toxins in the work we do, mitigating that, or if we have high stress and we're not managing it, mitigating that as well. And then stepping up the pyramid, the next step is stimulating the body's natural healing power. So that's a little bit similar to what I was mentioning about our body's innate ability to help protect us. And this is just offering a little bit of support in that way. So it could look like mental health or lifestyle counseling. It could look like physical medicine or a bigger focus on nutrition for someone that might need a little bit more help. And then if we go up to number 3, where we're supporting and restoring weakened or damaged systems. So this is just giving specific systems in our body a little bit more support. With it includes correcting any structural integrity. So massage therapy, spinal manipulations, and any system specific therapies. So if our digestion is needing a little bit more help, offering digestive support. And then the next step up is where we get into a little bit of actually providing specific treatment options that are having their own actions versus just supporting a function of the body. So this is where things like botanicals and specific nutrition recommendations can be used to really try to eliminate symptoms and address the underlying cause of those symptoms. Above that is any therapies that are replacing something that our body would otherwise use. So in this case, where we're talking about hormone replacement therapy, that can fall into that category. It's something that our body needs and uses, but maybe we're not able to produce at this time. And then above that is where we get into pharmaceutical management. We've reached a point where other therapies either are not an option or they haven't been beneficial, and a pharmaceutical is indicated in that case. And the final step of the pyramid is higher invasive therapies such as surgery and procedures. So with the risks that are associated with the conventional treatments, such as hormone therapy for those with current or past history of breast cancer, utilizing this therapeutic order can be a really safe yet effective approach for menopausal management. So we can go to the next slide, please. And kind of the base of our pyramid, nutrition is just a huge piece of that, supporting our body overall. And diet and overall nutrition plays a really key role in the prevention and maintenance of our overall health. And in specific condition, nutrition can play a more specialized role. So looking specifically in perimenopausal or postmenopausal individuals, we'll talk a little bit about things that are important to consider in terms of nutrition. First thing is we really want to keep our blood sugar managed well. increased spikes in blood sugar, spikes and drops in blood sugar can really exacerbate symptoms that are associated with menopause. So just having regular balanced meals and snacks with protein, healthy fats, complex carbs, and fruits and veggies is really important to maintain that balance. And with protein specifically, we want to aim at getting 60 to 80 grams of protein because we really want to support that muscle mass, and stay strong and healthy, and also help the blood sugar regulation. And then we'll talk a little bit more about specific nutrients or food groups that are beneficial in this population. So first I want to talk a little bit about soy. There's previously been information circulated that soy is something that increases cancer risk, but the most recent data actually shows a significantly decreased risk of breast and endometrial cancer with soy consumption. Soy is also rich in phytoestrogens, and it's shown benefit decreasing symptoms of vaginal dryness and frequency and intensity of hot flashes in menopausal individuals. Soy can also be a great place to get the protein requirements that we were talking about before. Foods like tempeh, tofu, soybeans, or edamame are great sources of that. Another food I wanted to touch base on just briefly, and Miles will talk more about in his sections, is flax. Flax inhibits a growth factor that is involved in cancer processes, and it encourages normal cell differentiation and avoids those mutations that occur in cancer. And flax has, like I mentioned, has a lot of other benefits that Miles will touch on. In terms of a few other nutrients we want to focus on, choline there's a higher dietary recommendation for choline in postmenopausal individuals. And the reason for that is in our bodies, estrogen is something that produces natural choline in our bodies. So when we're going through menopause and our estrogen levels are dropping, we need more of an outside source of that choline since we're not producing as much. Choline is really important to protect our liver and cardiovascular function against disease, and it also supports our brain function a lot. Choline can be found in egg yolks, potatoes, beef liver, and then cruciferous vegetables like broccoli and cabbage. Two other nutrients that are really important in this population are vitamin D and calcium. Vitamin D and calcium are really important for bone health, and they become a little bit more important after menopause because our hormones like estrogen provide protection to our bones. And since they're not doing that any longer, we really need that extra support. So things like dairy, spinach, okra, fortified milks, juices, and cereals are great sources of vitamin D and calcium. And then since we've talked about different nutrients and things specifically to focus on, I just want to touch base about a diet that is specifically proven or shown benefit in this population. The Mediterranean diet has been supported by research to be beneficial for prevention and treatment of various conditions, including cancer. There's been data that showed lower risk of cancer mortality in all individuals and a lower risk of all-cause mortality among cancer survivors. There's also been data that suggests it prevents cancer recurrence. And you'll be given access to some handouts that we made to go along with this presentation. And in the diet handout, there's a lot more information about the Mediterranean diet and even some sample meal ideas as well. And with that, I will hand it over to Miles to dig in a little more to our herbal remedies.
Thank you so much, Tia. That was wonderful. So I'm going to dive into one of my favorite topics, talking about herbal medicine, which is a big part of naturopathic medicine, and also just humanity. So herbal medicine has been a core part of humanity's relationship with plants, with health, with nature, since literally the beginning of human civilization. Herbs can act both like food medicines, like Tia was talking about, bringing nutrients that nourish specific organ systems, but they can also act as focused, biologically active therapies. And instead of focusing on suppressing or forcing physiology in a particular pathway, which some of our incredibly helpful and powerful pharmaceuticals can do, which have kind of a high affinity for a very particular pathway or for a very particular receptor site, herbs, on the other hand, often contain a synergistic collection of nutrients and active compounds that usually have a slightly lower affinity, but work synergistically. And the way that that's different is that they can encourage or gently guide the body to a particular outcome instead of pushing or forcing the body to do something, which is one of the reasons why some herbal formulas have less side effects. And we do want to place a disclaimer. We know that these herbs, what we're going to talk about, have been used with great benefit in patients who are postmenopausal and who are experiencing hormonal symptoms or menopausal symptoms. However, folks who have had breast cancer, especially hormone-mediated breast cancer, will definitely want to consult with a physician prior to implementing any new treatments like phytoestrogens contained in some of these herbs like red clover, or herbs that affect metabolic pathways like black cohosh. The long-term safety data in terms of like robust clinical studies isn't always there for all of these herbs, especially particularly for breast cancer patients. So it's just a disclaimer and a word of caution there. So just always, check in with a provider first. But anyway, jumping into some of our favorite herbs, we picked out 4 that are really popular here. And Tia lovely brought up flaxseed already. And flax is a powerhouse in a number of areas. We love flax. Flax seeds contain a number of nutrients. They contain not only these wonderful fibers that are nourishing and healing for the gut, they also contain omega-3s and omega-6s, which are anti-inflammatory, healthy fatty acids. And they also contain these compounds called lignans, which can increase circulating estrogen levels and improve estrogen metabolism and excretion in the body, which is amazing. They also have antioxidant effects that can help contribute to improved menopausal symptoms as well. Some of the symptoms of note that have been well researched for improvement with dietary flax include hot flashes and vasomotor symptoms, and a number of other menopausal symptoms. So typically what's recommended for flax, or what the research has been around, is 1 to 4 tablespoons of ground flaxseed a day. One thing that's interesting about flax is that some of the antioxidant properties, the anti-inflammatory processes can get lost from oxidation. So we generally recommend folks who are taking flax to grind it fresh, either the day of, or if you have like a little blade grinder, or you can grind it up and then freeze it. And that will preserve some of those properties that we're hoping to get. When people buy pre-ground flax meal, it's still good. It's got a lot of fiber in it, but it may have lost some of the other properties. So when you buy it pre-ground in the store, that's just something to consider. Yes. Oh, and then also it can be kind of mucilaginous. It can make kind of like a thick substance. So just be aware whatever you're adding that to. It's pretty tasteless, so most people find it easy to incorporate. People that put that on cereal, on salads. Sometimes they'll just drink it with oatmeal. Lots of ways to incorporate flax. So switching on, I'm going to talk about red clover, a beautiful, lovely smelling and delicious tasting herb. Red clover is a rich source of isoflavones, which are phytoestrogens. And phytoestrogens can mimic the effects of estrogen in the body, usually in a less intense way, so kind of a gentler way. They can trigger some of the effects of estrogen and kind of sub in for that. And because of that, red clover can reduce symptoms of estrogen deficiency. It can improve sleep. It can improve skin health. And it's just an overall great source of nutrients. One double-blind randomized controlled trial of perimenopausal women found that red clover extract showed a significant decrease in hot flash frequency, intensity, and severity with little to no reported side effects. And other meta-analyses have confirmed this relationship, particularly with the isoflavones. So wonderful herb. Next, I'm going to talk about black cohosh, another beautiful herb that's in the top right there. Black cohosh contains compounds like triterpene glycosides, which, like isoflavones, have a mild estrogenic activity. So they can help with hormone modulation, help to modulate estrogen levels and receptors in the body. And this has been well researched for helping with hot flashes, vaginal thinning, dryness. And it also has some anti-inflammatory and antioxidant properties, which can help modulate neurotransmitters as well. So it's also helpful for mood for many patients. Probably the most popular and well-regarded herbal medicine is on the bottom right there. That's maca. Maca is a root vegetable, actually. So this is another food medicine. It's like a tuber that's grown exclusively in the central Andes of Peru, and it's a traditional medicine and traditional food there. And studies suggest that maca can help balance hormone levels, particularly estrogen, during menopause. It helps to increase estrogen levels, and it can help alleviate symptoms from estrogen deficiency, like hot flashes, night sweats, vaginal dryness. Research also indicates that maca supplementation can significantly reduce the severity of hot flashes. It can help with the excess sweating, sleep disturbances, nervousness, depression, headaches, and loss of libido even. And some people even consider, for that reason, maca to be an aphrodisiac-like herb. It also has neuroprotective and antioxidant properties. And like I mentioned, it can improve sexual function. So it's got a lot of wonderful properties there. So these are some herbs we think about incorporating, and most of these are well tolerated. So, switching gears, I wanted to talk a little bit about mind-body techniques and stress management. So we started this presentation with a little bit of some grounding, some mindfulness, and there's actually some wonderful research about how therapies and activities that reduce stress actually can improve menopausal symptoms. And they do this through multiple mechanisms. This can include hormone regulation, psychological resilience, autonomic nervous system balance, reducing inflammation, enhancing immune function, and promoting just healthier lifestyle and healthier kind of psychological state as well. So all of those pathways are interconnected, and they highlight the potential of stress reduction as a valuable approach in managing the symptoms of menopause. And I'll go through each of these topics here, just share just really briefly that there has been some research on all of these. So cognitive behavioral therapy, there have been 2 studies that showed that a significant reduction in the impact of hot flashes, as an example, on how it was affecting daily life for patients with menopausal symptoms. Hypnosis has also been shown to reduce hot flashes by 74%, compared to 70% reduction in a group that just received education and encouragement. So in that study, that was quite a big difference. And another study showed that it was effective as venlafaxine, which is a medication that's used off-label for menopausal hot flashes. So that was super fascinating. Mindful-based stress reduction and meditation. They've done a randomized trial that showed that mindfulness-based stress reduction showed a significant decrease in hot flashes and night sweats, and improved overall kind of mental wellness. Yoga, which is kind of connected to our exercise slide, which I'll talk about in just a minute, also showed a significant improvement in hot flashes compared to an exercise group. So that was they actually compared it to another exercise group and found that yoga specifically was extra beneficial. And it also improved measures of cognitive function, attention, concentration, and memory in the yoga group. So there's some added benefit there. Sleep hygiene. We're going to send you a whole handout about sleep hygiene because it's so important. Sleep is crucial for health because it supports cognitive function, emotional well-being, and physical health. It allows our bodies to repair tissues, consolidate memories, and regulate hormones, which is relevant for this presentation. Adequate sleep is essential for maintaining strong immune system, overall health, and we would place that at our foundations of the health at the bottom of the pyramid, just there with nutrition and exercise. So it's something we value a lot, and we'll send you more information about that in the handout, whoever's curious. And then lastly, vagus nerve stimulation, which is our main parasympathetic nerve that helps us rest and digest as part of our nervous system. That's restorative and replenishing. And there are little things that there's research about stimulating the vagus nerve with things as simple as humming, chanting, or singing. So especially if they bring kind of a peaceful, stress-reducing quality, those can be valuable as well. I'm going to talk about movement and exercise a little bit. There is a lot of evidence to suggest that exercise, and especially multi-diverse exercise programs that incorporate aerobics, strength training, and mind-body exercises like yoga or Tai Chi, performed just a few times per week, 2 to 4 times per week, can be as effective, or can be an effective non-pharmacological approach for managing various menopausal symptoms. Strength exercises can improve hot flashes, fatigue, physical activity levels, and they're also wonderful for improving bone density, which is a big target of low estrogen treatments. And they can also help with metabolic and hormonal pathways as well. So strength training is a big part, and as well as the aerobic or kind of getting your blood flowing exercises. But there's also been some amazing research that even just walking for 30 minutes a couple times a week or every day can be incredibly helpful, not only for menopausal symptoms and stress reduction, but also reducing the risk of breast cancer as well. Yeah, so the general consensus is that a combination of aerobic exercise, even just walking 30 minutes 3 to 5 times a week, as well as strength training 2 to 4 times a week, can be incredibly helpful for the body and for kind of moving with these menopausal transitions. Yeah, so that concludes that. We got to the end. Thank you all so much. I'll let kind of Rachel tie us up here.
Thank you so much, Miles. Yeah, thank you guys so much for joining for our little workshop here. Like Miles said, we do have some handouts for you that we emailed to Amy, so she'll send those out to you guys. There's diet, sleep hygiene, stress, and then I believe one more. Yeah, a couple goodies for you guys. Just with some general tips and tricks that we came up with based off of looking at the research for menopausal support. But other than that, I just wanted to see if anybody had questions. And I see one in the chat. Let's see.
That's my question in the chat.
Great.
But if anybody else has questions, go ahead and just pipe up. Or I would even say if there's something that's really like plaguing you right now in this kind of area of your life, this is a great opportunity to, ask your questions like, what's burning on your mind on this topic. So feel free to pipe up. I'll ask my question while people are thinking. But Miles, when you were talking about all the herbs, I think most people are pretty familiar with flax and where to get it and how to use it. But I was curious if it matters if it's cooked or uncooked to get the benefits from it that you were talking about.
That's a great question. I think most of the research actually shows that there's some pretty stable qualities towards cooking it. So even though I do know there's some benefit from kind of freshly grinding fats, I think cooking overall, most of the qualities are stable. The omega-3 fats remain generally stable. It's more about long-term exposure to oxygen. That's the big risk. The fiber would not be affected by the heat. And the lignans, that was the property I was talking about earlier. Those are generally stable at higher temperatures as well. So it's more just how long they've been exposed to oxygen. So I'd say go ahead and cook with it. Yeah.
Okay. And then a couple more coming in, but I have one more question, which is some of those other ones you were talking about, like the red clover. I think you mentioned an extract. Like, can you speak at all to like where someone would get that or how to use it, or how do you incorporate that kind of thing into your life? If you've talked to your doctor and it's okay and safe for you to use it, where do you get it and what do you do with it?
That's a great question. I don't know if I'll be able to answer too specifically, but
Okay.
I think it's a really valuable question. And what I'll speak to about that is because herbal medicine can come from so many different sources, it's really good to get some help guiding where we can get them. Some people, just incorporating that on their own level, like I drink red clover tea every day. Like that's a good way to incorporate. I grow my own red clover. I cook with it. That could be an appropriate level of dosage. But with regards to the research and making sure you meet a certain dose, that would have to be more specific. And typically we'd bring in like some sort of supplement. I can't make any specific supplement brand recommendations for the sake of this presentation. That'd be a great thing to talk to a naturopath about, or another doctor who works with that. And there are some herbal preparations where certain research may say, hey, we want to standardize this a little bit. So there might be a certain properties or compounds that certain supplements will be like, oh, we've standardized this to include this amount of this compound. So I know that's really general, probably didn't answer specifically what you're sharing, but it kind of depends on how serious the therapeutic goal is. And also what's accessible. Because some people cooking with herbs and having that be a food medicine is enough. For other people who are really wanting to make sure that they follow like the research and get a therapeutic target, they definitely want to incorporate like a specific supplement. And most naturopaths and integrative or functional medicine practitioners or doctors probably have certain brands that they'd like to recommend. I think it would be overstepping to share any personally for me for this presentation, but maybe that's something we can send out later too, if people
Okay,
want.
thank you.
Yeah.
That's very helpful. Alice, it looks like maybe you have a question.
Yes, I do. And it's around estrogen, in that by taking an amylase inhibitor, or which the whole point is to tamp down estrogen. So a lot of my symptoms are problems of the side effects of having even less estrogen. But yet, so my question is that a lot of the herbs and aids that you're suggesting or talking about for helping with menopausal symptoms, do they raise any bit of estrogen at all? It seems like it feels like there's not a connection, or there could be. I mean, do the different herbs, yeah, it gives some natural estrogen boost. And where the medicine I'm taking and others is to kill every bit of estrogen in your body. Then I just wondering, are the ways that the alternatives that you're suggesting to help, do they really in this case? I mean, this is really a hard way. I'm having a hard time posing this question, but
I think I understand what you're
do the
what you're saying.
alternatives raise
Yeah.
the estrogen a little, and is that why they work? And if so, then would that be detrimental, since what the medicine I'm taking is to try and stamp out all estrogen or eliminate it?
Yeah, that's a really beautiful and thoughtful question. Thank you so much for sharing that.
Say,
And
so
and it's, of course it's
give it a
complicated too.
try.
Yeah, so I think the beauty of some of the herbal medicine is that some of them they're both modulating how the body's producing its own hormones. So in some ways it can increase how the body's producing estrogen. Obviously, maybe in your case or for certain patients where the target is trying to decrease that, and that particular target of the herb may not be like a good indication or something that's helpful for that treatment. It may be counterproductive. But the cool thing about herbs is that they work on multiple areas at once because they have such a diverse array of constituents and compounds. So some of the other things I was mentioning too, like the phytoestrogens aren't actually estrogen themselves. They might have some estrogen-like activity, but they're not actually bringing the actual estrogen levels up in the body. So that can be helpful and kind of skirt around that in some situations. And in other situations, it's the other things that they're helping with. So the antioxidant properties, the nutritive properties, those can also be super beneficial too. So I can't make any recommendations for you specifically. I think it's a really good question. I think the power of herbs and using them in a personalized, individualized approach is that we can, if there's a particular drug or a particular therapy that is targeting something that we don't want to mess with. I know some medications and some herbs, for example, like change how the liver's detoxifying or removing certain medications. We can find lots of other options to kind of get around that without affecting that therapy. So maybe if your doctor wanted to make sure that those estrogen levels are staying low, maybe incorporating some of the, like, for example, flax that helps eliminate estrogen or eliminate metabolites, might be something that, a naturopath or somebody would recommend, while also incorporating these other things like exercise, stress reduction, good nutrition. or maybe just herbs that are anti-inflammatory. So in a very general sense, I hope that was helpful. It's a very good question. There are lots of ways we can personalize it. That's kind of what I'm getting at here.
Okay.
Yeah.
All right. Thank you. Thank you.
Yeah, I just kind of want to add a little bit to that too. I think we talk a lot about the hormones and estrogen because of that being such a prevalent factor. And even though the low estrogen is what can be causing a lot of the symptoms, hormones affect a lot of things in our body, a lot of other symptoms. And a lot of the things we talked about reducing inflammation or just managing specific symptoms, a lot of that, like the diet and exercise, can be done with without affecting hormone levels. So it really gets down to why it's so important to talk to a provider about specialized care, because some providers might have different opinions on if you're on a medication like that, whether you should be using any sort of botanical that might influence hormone levels. But some of the other options influencing things like inflammation and stress reduction techniques can still be beneficial in some individuals.
Okay.
There are a couple questions in the chat. One person is asking, like, if they already feel like they exercise regularly and eat really well, what's the next thing to do that might be helpful for hot flashes?
Yeah, that's a great question. Based on, what we shared in the presentation, maybe exploring some of those mind-body connections could be a wonderful place to begin, especially if the hot flashes are really distressing and causing a lot of interruption to daily living. Maybe bringing in some of the stress reduction techniques could be something worth trying. And approaching health from the sleep medicine level. And yeah, that's probably would be, and maybe working with a provider to bring in some supplements or herbs could be theoretically potential. I'll let if my team has any other thoughts.
Yeah, I agree, Miles.
And then there's another question in the chat saying, the person is saying that they put on 20 pounds, and no matter how much they exercise or how healthy they eat, that weight just won't budge. And I'm going to take a guess that they might be on an aromatase inhibitor, because that is pretty common with people who are taking that. And so they're asking for any suggestions there.
Yeah, so unfortunately, as it goes, weight is such a complex thing. And there's so many things besides just exercising and eating healthy that impact weight. Like Amy mentioned, side effects of medications and in all different ways can impact our weight. Stress can impact our weight. Actually, not eating enough can affect our weight, and not eating enough protein. It's hard to give advice like that in a specific situation. And especially if you are exercising and eating healthy already, I think just working with even a nutritionist or dietitian could be beneficial to make sure you're eating enough, to make sure you're getting enough protein. And if you are on medications where that might be a side effect, then talking to the provider who manages those medications is really important as well. I know specifically in terms of the nutrition we were talking about, unbalanced blood sugar levels can contribute to weight gain, especially in postmenopausal women. So in highlighting that, the importance of eating those regular and balanced meals and higher protein levels is beneficial, but it's really hard, unfortunately, to give advice for a specific situation because, and it sounds like you're doing all the things, you're exercising, you're nourishing your body in the way you need to. So I think talking to either your provider that might manage medication if you're on it, or even a nutritionist or dietitian that might have a special area within this specific situation would really be a good idea. I'm sorry that can't be more helpful, but it's a very complex topic.
I had one kind of comment question that just came up as, I've heard a lot of people speak on a lot of different things in this job. And we had a provider a while back, a few years ago, who was doing a lot with us. And she was a naturopathic provider. And she sometimes would say, like if you're waking up, a lot of people wake up in the night with those hot flashes. And I'm just curious what your all's opinion is on this, to like have a spoonful of peanut butter or some kind of like protein rich thing like that, sort of as your pre-bedtime snack or whatever, something along those lines, to kind of help that. Is the idea there to help the blood pressure not spike, or the blood sugar not spike? Is that, I'm just
Yeah.
curious what you guys think about that.
Yeah, that specific advice, don't know what their like mindset was with that. I'm assuming that the blood sugar regulation is something they were considering, because there is a lot of data showing that unbalanced blood sugar levels, especially lack of protein, can exacerbate menopausal symptoms. So yeah, I would assume that's the aim they were taking with that.
Okay. Does anybody else have any other questions? I'm just full of questions. I got one more. So my final question is, I know you guys have talked a lot about like checking with your doctor, and I can speak from experience on this, and I know I've seen it on our private Facebook chat. Like, it is very difficult to find uh, a regular, just like primary health physician that you like, that takes your insurance, that's open-minded towards natural practices. Do you all have any ideas there, or help in, like, if someone is wanting to find a natural provider or a functional medicine provider, what's the best way to go about that? You have any ideas on that?
Yeah, it's hard. I think a lot of people will have a primary care MD and also see a naturopathic physician for
Mhm.
adjunctive support. We're lucky in Oregon, naturopathic physicians are able to prescribe medications. And I'm not sure if anyone's familiar with what a FABNO is, but a FABNO is a naturopathic physician that's actually done extra training to be specialized in oncology. Um, I
Okay.
don't have any names off the top of my head of FABNOs in the area, but that could be a good place to start when you're looking for someone to manage kind of both things. I think also looking for an ND, even if they're not managing your medications for post-cancer or current cancer care, we are trained to know what medications and herbs interact with those things. So we can still give supportive recommendations and be confident that we're giving a safe recommendation.
Okay, thank you. Anything else from anybody? Okay. Oh, somebody just popped in. Um, she said my FABNO is Cynthia Bai in Vancouver, Washington, and she's actually retiring and passing the practice to her colleague. So sounds like there's an office in Vancouver if anybody else is in that area. I'm sure we have him here. It's just a matter of finding him. And, actually you might even have that conversation with your regular oncologist, and they might be able to um, give you some ideas there too if you're looking. So I just want to thank all three of you so much for the time that you all spent in your, I'm sure, like very hectic final weeks here to put the presentation together for us and take time out of your schedules to be here and present to us. And I just really appreciate you all doing that. I appreciate our collaboration with NUNM. We do a lot of cooking workshops with them. We have one coming up later this month. And it's just a wonderful resource in our community. So we really appreciate you guys, and going into the field. We appreciate you being out there in the workforce for us too. I did just see one more question come in. It says the AIs seem to cause a lot of joint pain. Are there any natural, remedies to help ease the stiffness attached to that?
Yeah, I can speak on that. Well, again, we can't give like specific recommendations. Really, with joint pain, anti-inflammatory support is really your best bet. And I know with joint pain specifically, whether it's like supplements or dietary things with anti-inflammatory properties are really helpful. Also, movement is so crucial, which I know some people hate to hear because they're like, I'm in pain, like I can't move. But even really, really gentle movements, like body weight squats or yoga, really gentle movements, to make sure you keep that mobility in the joints is so crucial. So that they don't get, locked up and more inflamed and more painful. So just getting that like that lymph flow, that blood flow, that circulation with daily gentle movements is so crucial. And then again, of course, talking to your doctor about specific anti-inflammatory remedies, whether that's natural or pharmaceutical as well.
Thank you for answering that final question, Rachel. Okay, I'm going to go ahead and stop the recording.